Hey guys, Dr. Rachel here. So this exercise I'm going to be going over is really just talking you through proper lower core activation, okay? So this transverse abdominis muscle that runs across your hips more this way is a muscle that I commonly see that is being bypassed when doing a lot of core exercises. We're very more rectus dominant here, our more middle abs. So we really don't have this stabilizing muscle here to help with pelvis control and really positioning as well. So what I tell people to help with activating it, so first, before I even lay down here, find your hip bone, okay? And you're gonna just take your fingers about 1 or 2 inches inside there, okay? So with that finger placement, all right, you're gonna lay down, place those fingers, like I mentioned, right inside those hip bones here. I want you to imagine, like, you can think about either drawing your hands, your fingers together, like you're trying to pull your hip bones together. See if you feel a muscle come in underneath those fingers. So you can think of that. Might work for you. Lightly pushing your back down to the floor. So you're doing a little posterior tilt of your pelvis, but we are not squeezing our glutes. So just slight push back. Again, should feel a little muscle coming in underneath your fingers. The key here is feeling that muscle coming in, but not feeling your fingers popping up dramatically, okay? This muscle, when it fires, you should feel more of a slight drawing in, okay? Not fingers, again, really lifting up, okay? That's, again, a little bit more of that rectus muscle coming in, okay? So you can also feel this muscle when you're working on an exhale. So if you're working on that nice inhale in, expanding everything, exhale out like you're fogging a mirror. Emptying all the way out, you should feel those core muscles contract. Not feel that tension in your shoulders. You're not forcefully pushing the air out. You're just exhaling with that ha type sound, and use the very end of emptying should feel that. Once you can get those TA muscles, like, okay, yep, you can feel it, connect it, can just do it on command, connecting them. You can always then progress to firing those TAs and then adding in some lower body movements, focusing on, can you feel this muscle maintaining its contraction? I always tell people the good old test, like if you can actually do the dead bug exercise with like your, both feet up and both hands up, is again finding that TA muscle, that transverse abdominis muscle, finding that muscle, bringing both legs up with maintaining that muscle and not getting a lot of rectus or a big bulge here in the middle. Or if you start seeing like your back coming up off the floor here, okay? So if you have any of those signs, I would take that as maybe not ready to pull both feet up in the air. Stick with the marches until we can get stronger, able to control it better. Then go ahead and do those dead bug exercises, okay? Have any questions? Let me know.